This is your friendly neighborhood oral maxillofacial surgeon, Dr. Watson, Doc Watt. I feel like I need to talk about toothaches today because over the holiday, my little cousin had a toothache. Worst day ever, like literally on Thanksgiving. So had to open up the office with a friend and evaluate him. And it wasn't from a candy, it wasn't from a cracked tooth or anything like that. It was actually from an odor filling that had been placed close to the pulp chamber, which is normal to do. But eventually the tooth had become necrotic or it died. And that's what caused the pain and the toothache. So when the pulp chamber, where the nerve and the blood supply sits, dies, the only way to save the tooth is to do a root canal procedure, endodontic procedure, which is done by your dentist or your endodontist, not by most oral surgeons. Um, Otherwise, you remove the tooth or you extract the tooth or you use the yankers, like my son says, to remove the tooth, which that's only if you need me, right? So this situation is more common than people realize. Even well-placed fillings can sometimes sit close to the nerve, especially in young teeth with large pulp chambers. Over time, irritation, bacteria, or leakage around the filling can cause inflammation and even death of the pulp chamber. So some of the common causes of toothaches are deep decay. This is when bacteria just, you know, gets into the tooth, deep into the tooth beneath the dentin and can cause pain or sensitivity. Old or large fillings that are close to the pulp chamber, like we talked about, can cause pulpitis or necrosis. Cracked teeth, tiny fractures can expose the inner tooth structures, leading to sharp pain when chewing or drinking cold liquids. Gum infections. This can cause significant throbbing pain and even bone loss around the teeth. And of course, trauma. If you crack your tooth or you have some type of trauma, it can damage the nerve sometimes without even a visible crack. People who clench or grind, we call it bruxism, put significant amount of pressure on your teeth and ligaments and bone, and it can cause significant aching or even cracked teeth. And then wisdom teeth. We know about the wisdom teeth. They try to come in, they don't have space, they can cause pain. Your teething can cause infection as well. So the takeaway is that when you have a toothache, it is more than just an inconvenience. It's actually an alarm that something worse is probably going on. And if it occurs for more than 1 or 2 days, you need to see a dentist, maybe your endodontist, and sometimes you need to see your local, friendly neighborhood oral maxillofacial surgeon like me, Doc Watt, at your service.